Hi, I'm Jeff Blumberg, and I'm the Chief Operating Officer at MGE. And the subject of this week's tip is, should you raise your fees? Should you raise your fees? We get asked this question, especially by new clients. Well, the first question I would ask, if someone asked me that, is, when's the last time that you raised them? You should be raising your fees in a dental office every year. The amount you should be raising them, and there's a few considerations on this, but the initial consideration to how much you should be raising your fees is you at least want to match inflation. To tell what inflation is or has been, you can look at what's called the Consumer Price Index from the Bureau of Labor and Statistics, which is basically a grouping of goods, and they track how much in price these go up every year. To give you a little bit of an example, so far for 2019, the inflationary rate is 1.8%. For 2018, it was 2.4%, and it was 2.1% in 2017. Now, that's an average, and it can be a bit deceptive. Certain things went up more than others, and some things actually went down. So with a pretty safe number, and what has been sort of the acceptable number for years in the industry, is about 3%. If you raise your fees about 3% a year, it's pretty safe. As far as how you go about doing this, it's pretty simple. You take your price, you look at raising it 3%. You might round it off so it's not a fee doesn't go to, $78.27 or something like that. You might just charge $78 or $79. And you do it. Usually the best time of year to figure this out is in November and December, because you have a lot of fee codes, CDT codes. So you want to make sure that this isn't something you're trying to do at the last minute. And then before the end of the year, you should sit down with your staff so that everybody's tracking with, what the fees have now increased to, especially with your finance people, your financial coordinator, or treatment coordinator, because usually these people tend to get these numbers stuck in their head. They're used to a crown costing this much and so on. So you want them familiar with what the new prices are going to be. Now, there are a few things to consider. First one would be, what are your fees? How did you set them? Maybe you set them based on what a chain was charging that is down the street because you're trying to compete for patients, which I wouldn't recommend because they have a bigger economy of scale than you do. You have to meet your overhead. And the truth is, some people are going to be completely fixated on price, and that's fine, but the majority of people aren't. They're very, very interested in customer service. So if you provide good customer service and you charge a fair fee, that's okay. It's okay for you to charge a fair fee. So what I'd go out and do is get one of those national dental fee surveys. There's the National Dental Advisory Service has one that's great, and it breaks it down by, what's the median range price, 50 percentile, all the way up to the 95th percentile where the prices go higher. I personally wouldn't set my fees lower than the 60th percentile. You might want to be in the 70th percentile or maybe a little bit more. But to give you an idea of how this can affect the practice, we had a client I was sitting down with back in 2002. This is a long time ago. They'd purchased a practice from another doctor who hadn't raised their fee about a year prior. This doctor hadn't raised their fees probably most likely since the 80s. And it showed. His hygiene schedule was booked, yet his hygiene overhead was about 60%. In other words, hygiene salaries for a booked schedule was 60% of his actual production because his fees were so low. His periodic oral exam fee was less than Dr. Winteregg was charging in the 80s when he had just started his practice, to give you an idea. So this is where it's useful to take a look and go, okay, where do my fees compare? So let's say you find out your fees are really low. You're not even, like when I went with this doctor, some of his fees didn't even fall into the 50th percentile. So what do? Well, in a case like that, or if, for example, you haven't raised your fees in 5, 10 years or something along these lines, you don't want to do a big, huge cold water dip for your entire patient base. They came in last time and a cleaning was $60 and now it's $130. That might freak people out. So what you could do, and this is what I had this client do, is we took his restorative fees and we raised those closer to what they should be immediately. Then we took the fees for things that patients were getting all the time, exams, cleanings, and so on, and we incrementally raised those every 6 months until he got to where he needed to be. So you can do something along those lines. It really depends on your situation. And if you have questions, you're always free to email me at jeff@mgeonline.com. The other thing to consider is managed care. If you have a lot of managed care in the practice, what actually ends up happening is you end up with your fee-for-service patients or people paying full fee effectively subsidizing your PPO or HMO patients. If we were to say that the average PPO write-off was 30%, then what ends up happening is for every 1/3 of the practice that is PPO, you've effectively done a 10% fee decrease Dr. Winteregg did a bunch of studies on this. We actually have a pretty interesting website you can go to called raisemyfees.com, where what Dr. Winteregg did is he put a whole calculation together showing that if you were to raise your fees, which dropping managed care is effectively raising your fees, how many patients you could afford to lose and still stay at the same level of profitability. Not that you would want to lose patients, and if you handle it right, you'll lose a lot less than you might think. But the point he wanted to make was that if you charge your full, like what ends up happening is when you bring a ton of reduced fee plans into the practice, you end up just working harder for less, essentially. So I definitely check that out, raisemyfees.com, if you want to see how that might affect your practice. Now, if you do find that you have a considerable amount of managed care and you want to start moving that out of the practice, I also would recommend that you have a plan. The last thing you want to do is if 50 or 60% of your practice is on, XYZ PPO or a couple PPOs, is just dump them whole cloth, and then you end up with a situation where you're losing patients. So in that case, I'd recommend that you need a strategy to be able to get out of the PPOs, as well as you need to be able to get a volume of new patients into the practice. And for that, I'd recommend the MGE service, the MGE New Patient Workshop. You can find out more about it at newpatients.net, but at the New Patient Workshop, we can show you how to get a steady stream of new patients into your practice so that you can continue to expand and you don't feel like you're at mercy of the insurance companies. Well, I hope that helps. Don't forget to subscribe and click the notification button so you can see more tips like this as they come out. And if you want to find out more about MGE, you can check us out at mgeonline.com or call us at 800-640-1140. We'll see you at the next tip.